To reduce neonatal mortality, NEST360 equips hospitals with a package of life-saving medical devices, training, and tools to improve quality of care for small and sick newborns. The NEST360 model goes beyond the delivery of equipment and training and uses a health system approach to ensure each neonatal unit has the capacity to deliver improved outcomes of care. From a program's inception, NEST works with ministries of health and other key stakeholders to improve the quality of care. This includes the selection of health facilities, the implementation of improved medical devices, training and best practices, and the sustained use of the NEST model. So, what is involved in revolutionizing the delivery of neonatal care? Once a facility has been identified as a potential NEST site, a rapid service readiness checklist is used to determine whether the facility has the basic resources and infrastructure necessary to support the NEST package, such as access to water, electricity, and human resources. Even if a facility does not meet one or more of these criteria, the checklist serves as a tool that hospital management can use when requesting resources and improvements to get a facility ready to qualify for NEST implementation. In Tanzania, this checklist enabled hospital managers to advocate for and make major innovations to create safe and more conducive newborn care units in a number of facilities. Once a facility has met the standard inclusion criteria to implement the NEST package, it undergoes a detailed baseline health facility assessment to assess the facility in 5 main areas: its infrastructure, devices, pharmacy and lab, human resources, data collection systems, and family-centered care. Feedback from this initial assessment is shared with hospital management and provides insight into key areas of improvement at the facility level. In Nigeria, rapid feedback reports were eagerly received by management at NEST facilities and led to fruitful discussions on how to address some of the gaps identified by the health facility assessment. The health facility assessment is followed by equipment installation and training for both clinical and biomedical staff at a facility. Training focuses on the appropriate use and maintenance of equipment and is usually followed by a connection with mentors to help bridge theory and practice after training. In Kenya, the process has been transformative.
They have a sudden awareness that I actually have the power to change the life of this baby. And they go ahead, and since we've given them the tools to do that, they go ahead and do it. I could give you many, many stories, but all the stories, the bottom line is somebody's way of thinking is changed, and somebody buys into the vision of whatever small I can do, if I do it well, it will make a difference. And I think many of the people we have trained, that is what they have gone home thinking. I'll give you a very good example. We have a national hospital which has a branch at in Nyeri, and we have about 7 neonatal nurses who work in that unit. Do you know they got their whole hospital together and they ran a whole training by themselves? We didn't fund them. We just gave them the slides to use, the material, the protocol to use, and they went ahead and did it by themselves. So that's also another beautiful thing that we have learned. We have built the capacity of people to be able to train themselves, to be able to be leaders, to be able to be mentors, to be able to be an example, even with how you behave when you're in the unit. So it's been amazing.
NEST emphasizes continued support and quality improvement for facilities beyond installation and training. Quality improvement visits are conducted by a multidisciplinary committee on a quarterly basis. These visits provide an opportunity to improve the quality of newborn care using data and locally led actions to monitor and improve performance. During this visit, the committee examines the performance of information systems, clinical care, biomedical tech, and management. Data and evaluations from these visits feed into a quality improvement dashboard that is used to guide course-corrective actions. In Malawi, QI visits have been piloted in 8 NEST facilities with coordination and leadership across multiple directorates within the Malawi Ministry of Health.
The aim of this, it is to improve the care that is given to the neonates that are admitted in these facilities. why we do this type of activity? It is to ensure that the quality of care being offered to these neonates is of high standard. Collect data. And that data help us a lot in the ministry to know which facilities are having problems, which facilities needs more support than the other, and which facilities needs more resources than the other. So as a minister, we are guided by this for resource allocation, and then even resource distribution. So these pieces are very, very important to the ministry. But more importantly, it is during these facilities that we identify the gaps that are existing in these facilities. In turn, we have seen great improvement in terms of those neonates who are leaving the facilities alive going home, and mothers smiling, happy